Good morning. Good morning. Welcome to the 25th Annual Research Showcase. I would like to congratulate the New Jersey Department of Transportation on their silver jubilee of holding this event dedicated to research and innovation that has been applied to New Jersey's transportation network. Everyone, give the DOT a round of applause. 25 years. I am Dave Maruca, and I am once again your moderator. My apologies. I just lost my spot. There you go. The DOT's theme for this year's event, Commitment to Safety, which is a topic near and dear to my heart. I promised myself I'd put my hand over my heart. Cell phones, please, at this time, can you put them on mute? I've already done it early this morning because I'm usually the guy that doesn't turn it off. But if you wouldn't mind, turn them down, turn them off for us, please. Restrooms, if you go out the door you came in and you go towards the back and make a right, there's restrooms there in that hallway. And also, if you go up the steps where we have that gorgeous banner of balloons, you can go up there. There's also bathrooms up on the second floor. Exits, please look around at your exits, where they're at. We have them in the back, we have them over here, and God forbid something happens, we want to be able to exit quickly, right? You can go outside, right out, if you go through that exit that you came in, right outside those doors, you can exit very easily. And this is a smoke-free campus. For the last 10 years, it's been not, you couldn't smoke here, and I was telling people, go out the door and smoke right out. No, it's a smoke-free campus. I learned that actually this year. If you have any questions regarding a topic, please go to the strategically located mics. If you look, they're on this platform over here, in the center aisle, which will be after our keynote presentation and the panel discussion. So you're going to have to get up and go to these mics right here if you would like to ask a question. Certificates will be provided for attendance at the end of the day as you exit the building. This conference provides 2 professional development hours for professional engineers. We're also making available AICP maintenance credits for planners. Today's presentation and video live stream will be posted on the NJDOT Tech Transfer website after the event. I'd like to thank Civic Eye, who's up there, for their efforts in making this possible. Please do not bring food or drinks into the auditorium. Lastly, a survey of today's events will be sent to your email via SurveyMonkey. Please complete the survey to assist us in improving this program for the next 25 years. For welcoming remarks, I would like to take this opportunity to introduce Andrew Swords. Mr. Swords serves as the Director of the Division of Statewide Planning at the New Jersey Department of Transportation. In that role, Andy leads several teams responsible for a variety of transportation planning functions, including long-range, performance-based and asset management planning, safety programs, bicycle and pedestrian planning, and complete streets, traffic congestion analysis, air quality planning, the Transit Village Initiative, and State Planning Commission coordination. That's a lot, Andy. The division also manages the department's Research and Innovation Program, the State Planning and Research, that's SPR program, and the work programs of the state's 3 metropolitan planning organizations. Andy has 34 years of experience with New Jersey's DOT and is a licensed professional planner in the state of New Jersey. Let's give a warm welcome to Director Andrew Swords.
Thank you, David, and good morning, everyone. Good morning. Okay, I assume you can all hear me okay? Yes. Good. I'm going to try not to use my reading glasses. Let's see how that goes. So I think I'm okay. So, good morning, everyone, and welcome to New Jersey DOT's 25th Annual Research Showcase. I'm really pleased to welcome you all to this truly one-of-a-kind event. Our research showcase provides an opportunity for New Jersey's transportation community to see the breadth and depth of academic research being conducted by our partners, the institutions of higher education and their associates. It's a unique opportunity, and so I'm glad to see such a great turnout. The theme of this year's research showcase is our commitment to safety. The strength of that commitment will be demonstrated throughout the day as we see the great variety of expertise and topics that we will explore together. This morning, we're grateful to have Dr. Allison Curry from the Children's Hospital of Philadelphia to serve as our keynote. Later this morning, we will present the Research Showcase Awards. And this afternoon's breakout sessions will enable us to dive deeper into the details of numerous safety-related research projects. But right now, I would like to acknowledge the people that make it all happen. Today's partnership is organized by the New Jersey DOT Bureau of Research in partnership with the New Jersey Local Technical Assistance Program at Rutgers University, better known as LTAP, at the Center for Advanced Infrastructure and Transportation, better known as Rutgers-Cate. I would like to thank Janet Lely and her staff at Rutgers-Cate, especially Dave Maruca and Jessica Brown. I would also like to thank the manager of the Bureau of Research, Amanda Gendek, for her ongoing leadership. Thanks also to the NJDOT project manager for the showcase, Pragna Shah. I would also like to acknowledge the rest of the staff at the Bureau of Research. They are Stephanie Knock, Sneha Shah, Sue Rizzo, Priscilla Ukpa, Stephanie Patapa, Giri Venkatila, Kamal Patel, Mansi Shah, and our research librarian, Eric Schwartz. For those of you in the staff who are here, would you please stand so you can be recognized? About a round of applause. I also want to take this opportunity to acknowledge our research partners and express my gratitude for the value that they bring to NJDOT's research program. Without the efforts of the university staff, our principal investigators, all of the students and grant administrators, we wouldn't be here today to showcase our collective success. And lastly, I would like to acknowledge a few people for their ongoing support. First, thank you to Commissioner Diane Gutierrez-Gichetti, Assistant Commissioner Eric Powers, and Assistant Commissioner Parth Oza for your attendance today. Thank you to Federal Highway Division Administrator Robert Clark and your dedicated staff at the Federal Highway New Jersey Division Office for your continued sponsorship of this program and the ongoing partnership we have. And thanks to you, today's attendees and presenters, for taking the time to participate. I hope you all enjoy today's session. So without any further delay, it is truly my honor to introduce the Commissioner of Transportation, Diane Gutierrez-Gichetti. We know how busy you are, and we are grateful that you are here today. Thank you, Commissioner. Sorry.
Well, good morning. As you can see, I'm a hugger, and the DOT has adjusted to that, so that's really a good thing for me. But it is my absolute pleasure today to be able to welcome all of you to the special 25th anniversary celebration of the annual New Jersey Department of Transportation Research Showcase. I also would like to welcome and thank the Federal Highway Administration, Robert Clark and his team, for supporting and sponsoring today's event. It is great to see so many faces from New Jersey DOT, New Jersey Transit, our world of academia, and our transportation industry partners. I would like to thank our MPOs and our local public agencies for joining us today. I have one other person I'd like to thank, and that is David Maruca. Since I have been coming to the Research Showcase, David really makes it an enjoyable and a relaxed and fun environment, which I think is key to good collaboration and success, right? David, he's honest and he's energetic and he keeps us going in the right direction. And the most important thing for me is that everybody here feel that they can contribute. And I think David sets a wonderful tone like that. So I would like to thank you myself from the bottom of my heart. So. I'll never forget the first time I came, he came up to me and he kissed my hand and said, "Thank you so much for widening the turnpike." It changed his life. That's exactly what he said to me. It gave me back so much time in my day. So that I will always remember, because not everybody feels that way yet, but we'll get there. So since 2023, marks a milestone year for the Research Showcase. And I want to take a little time to look back on how we got to where we are today and to envision where we're going. The first Research Showcase was held 25 years ago in 1999 and was initiated by New Jersey DOT retiree Nick Vitillo, then manager of the Bureau of Research. The inaugural event was held at Rutgers University's Livingston Campus Student Center. The intent of the Research Showcase was to bring together NJDOT research customers and academia to generate ideas for future research and develop problem statements that would ultimately lead to infrastructure improvements. Over the years, the format of the event has varied, as did the venue. Research partners like the College of New Jersey and Burlington County Community College were among some of the host institutes. Then, in 2006, the showcase found a home here at Mercer County Community College, and it has graciously hosted us ever since. With the addition of a poster session and awards presentations, this event gives well-deserved recognition to the diligent efforts, determination, ingenuity, and curious minds present in this room today. Over these past 25 years, the Research Showcase has hosted a distinguished group of keynote speakers, including representatives from USDOT, the New Jersey Governor's Office, FHWA Turner Fairbank Highway Research Center, American Society of Civil Engineers, and corporate partners like LM Industry Local Motors. The broad range of knowledge and insight shared at this event demonstrate the collaborative nature of transportation research. The showcase is an opportunity for us to gather and focus on important transportation topics such as equity, sustainability, and resilience, the evolution of smart cities, and transformative technologies like autonomous and electric vehicles. There is one thing that underpins all these topics. It is something that is baked into everything we do at NJDOT, a common thread that runs through every step of an operation, from filling potholes to replacing a bridge and even conducting research. It's also the focus of this year's showcase, and it is safety. NJDOT's #1 goal is to provide a safe transportation system for all. That means residents and those traveling through the state, whether by car, truck, rail, bus, boat, plane, bike, on foot, or with mobility assistance. The research projects showcased here today, and everyone in this room, help in the pursuit of that goal. Throughout the day, you will see examples of how your findings can create opportunities for positive change and improve the quality of life in New Jersey. Your work is helping shape the future of New Jersey's transportation system so it can continue to become more efficient, more equitable, more environmentally responsible, and safer. Having said all of that, I hope that you know that the fruits of your labor have resulted in, to a large extent, the reduction in fatalities in New Jersey by approximately 18% over last year. That is a huge accomplishment. When we can save lives, even one, we can go home at night and feel that our day was a success. But research is at the foundation of everything we do. Without an understanding of the implications of actions, without data to support our decisions, we will go into a project with a lot of uncertainty. And in our business, uncertainty does not lead to safety. So the work that you will do here over the course of this morning, over the course of today and this afternoon, is imperative. It's interesting because I have to tell you all, this is probably the last time I will stand before you as the DOT commissioner, and my last research showcase, which I'm not going to tell you doesn't make me sad because it does a little bit. But sometimes you get asked to do different things, and sometimes you have to answer that particular call. I will always, in my heart and in my new assignment, look at how transportation is foundationally important to everything that happens in state government. You'll often hear me say that transportation is the one service everyone uses every day. It is the one governmental supplied service that everyone uses every day. And people have said, well, almost everyone, Commissioner. And I said, no, everyone. How many of you got an Amazon package dropped on your door? How many of you received the US mail? How many of you have an elderly parent or a homebound family member that receives Meals on Wheels? How many people of you have had your Walmart delivery dropped at your door? We are a transportation-centric society. We have used transportation in a different way, but we use it every day. And when I say in a different way, I really want you all to focus on where US DOTs are looking, not US, DOTs in the US, not the US DOT. Heaven forbid, I don't want to speak for them. That's Robert's job. DOTs across the country are looking at something what we call the Moonshot Project. And there's Amanda. Amanda will become more educated on this as we go to the AASHTO annual meeting and we go to TRB. But the Moonshot Project really is something that will be research-based in a significant way. It is a concept that says the last thing we did together as DOTs across this country was build the interstate system. That was a long time ago. What do we do now? How do DOTs evolve to the demands of society today? And what you'll learn, and hopefully you'll be able to participate, and if not, we will make sure we bring it back to New Jersey, is we are looking at how we become a community-centered transportation system. We will always build highways, we will always maintain state of good repair, we will always replace bridges, we will always make sure public transit runs. But communities need our help. Today, the world is changing, especially after COVID. People bike more, they walk more, they find different ways to travel. And as DOTs, we have to find a way to build that into what we do. It's a little different for us, right? Especially New Jersey as a home rule state. We don't, county roads, local roads, no thanks, we got enough of our own. That's true, we do. But some of those state highways are main streets and communities. And we need to learn to think a little differently when we're supporting them and when we're doing a project in their town. The way that's going to come to pass is through the research that we do that tells us what makes sense for a DOT to do when it has to shrink down to the community level and support them. It is critical that we understand the importance of complete and green streets. It is critical that we understand, who knows who Alice is before I forget? We understand Alice. Who in this room knows who Alice is? Did you ever meet Alice? I'm going to introduce you to Alice. Alice is asset limited, income constrained, employed. Alice is going to become a focus of DOTs. I take Alice with me everywhere in the car. And why do I do that? Well, Alice probably can't afford a car right now. Or if she can afford a car, it probably isn't a very good car. And if she can't afford a car, it's because she can't buy insurance. She may be working 2 or 3 jobs just to make ends meet, but has trouble getting there. How do we help Alice? How does transportation play a role in that? Well, it plays a role in forward thinking, looking at what we can do from a design perspective to improve sidewalks, bike lanes, active transportation in places we never thought we could. Now, we can't just go out and do that today because we don't have the data and the research to determine it's safe. But that's what I hope that all of you will think about today. When you're thinking about safety, don't think just about cars and trucks and motorcycles. Think about Alice and how we get Alice to her jobs. I would like someday for Alice to get out of my car, not because I don't like Alice, because Alice really wants to be independent. Alice doesn't want to be dependent. Alice represents the working poor. When we build a bridge, if it doesn't have sidewalks on it today, when we reconstruct it, put sidewalks on it. I don't care if there's sidewalks on either side of it. Those can come later, and they can come much more quickly than rebuilding that bridge will. Think about things we can do to really improve the lives of those who struggle to achieve a quality of life in this country that most of us, if not all of us, enjoy every day. How do we help Alice get to healthy foods? How do we help Alice get to better education? How do we help Alice and through a transportation system that makes sense? I learned about Alice about little better than a year ago, from a woman named Stephanie Hoops, who is the director of United for Alice through the United Way. She has spoken at NASTO and many other ASHTO events because we are all focused on the fact that we have a responsibility in transportation in this area. And I hope that all of you, in your research and in your studies and in your thoughts and your collaboration, will continue to consider Alice as we make plans and recommendations and develop problem statements that make sense for all of us. And I will close with the one thing I always say when I see a group of this size. I hope today you will leave here with one new idea and one new friend. Connect with somebody you've never met. Find something that really resonates with you and take it back to your agency or your community and see if it's something that works. So I just ask, my last ask of you is to leave here with one new idea and one new friend. And if you do that, I think as a community, a transportation community, we can do nothing but be successful in providing safer, more efficient transportation for all of those who need us. Have a wonderful showcase. Thank you so much for having me all these years. Thank you, Mr. Maruker, for being such a great facilitator. I wish you all well.
I just got nervous all of a sudden after all those accolades. Thank you, Commissioner. I appreciate that. Commissioner, do you have to go? I mean, being the commissioner? No, I'm just kidding. Because I've never gotten accolades like that before, and I appreciate that. Thank you very much. I haven't felt that important in a long time, if at all, so I appreciate that. Thank you very much. Okay, our final speaker for opening remarks is Robert Clark. In September 2013, Robert became the FHWA New Jersey Division Administrator. As the division administrator, Robert is the principal representative of the Federal Highway Administration in New Jersey and is responsible for administering the federal aid highway program in the state. Robert has been with FHWA for 19 years. Prior to that, he worked for the North Carolina Department of Transportation in a variety of positions. Robert holds a bachelor's degree in finance from Georgia Southern University and a master's degree in public administration from North Carolina State University. Please give a warm welcome to New Jersey Division Administrator for the Federal Highway Administration, Robert Clark.
All right. So first question to you guys, how many of you attended the safety summit yesterday? Okay, that's going to be funny. Last night, well, the reason I say that is I changed my mind on what I was going to talk about today in the middle of the night. I gave opening remarks yesterday at that summit. And knowing that this is focused around safety, I wanted to share that same message, but add in where research actually comes into play and what we're doing USDOT-wise, Federal Highway, and the Volpe Center. You know, ending traffic fatalities around the country is our top priority. USDOT, Federal Highway, our DOTs. Fortunately, we passed the bipartisan infrastructure law, which seriously increased our funding. Our DOT has put it to good use. I can attest to that. Has anybody heard of the National Roadway Safety Strategy from the USDOT? Not many. Okay, well, I can tell you that's where we're putting a lot of our research money into. And what it includes is safer people. How do we get the message out? Requires research, guys. Safer roads. It's engineering, yet it still needs research. Safer vehicles, we talked about that. That's being done mostly by the corporate section, but we're building the infrastructure for that. Safer speeds, and not everybody likes to hear that, but you know, do we need to have 70-mile-an-hour speed limits. And I'm sorry, because you drive on the turnpike and I know you like to go fast. But I'm just saying, you know, speed kills a lot of people, guys. So we're looking at that. And then honestly, post-crash care. You'd be surprised how important TIM is. Our DOT is one of the best in the country in training. Like, we've trained the second most responders in the country. And I want to applaud the MPOs, especially the DOT and the operations unit. They've done a fantastic job, and we are nationally recognized for that. Here's something, and Diane mentioned this. We've seen a reduction in fatalities. This is third quarter numbers. So let's not pat ourselves on the back right now. We still have a ways to go. Nationally, we're down 3%. Just recently, we're at 17.7, Diane, not 18. But I know. But anyway, so we are making a difference. And a lot of that has come through the research that you all have done, that Turner Fairbanks, which is our research division, and our Volpe Center, which is the USDOT's research section. You know, as we work to improve safety through equitable, and I want to repeat that word. That's something that I know Diane has embraced. I've seen it since day one, even before it was a thing. Equitable planning and programming of our infrastructure investments. You know, it's time now that we double down on transportation safety. We're making progress. Let's not stop. Focus your research on that. What can we do better to save lives? Effective messaging. Diane and I just had a discussion about that, and I'm with you. We can reverse the deadly trend. We can shorten the term as we move forward in our ultimate goal of 0 fatalities. I know that sounds ridiculous, guys, but we can get there. We all have a shared responsibility. Our engineers, our researchers, even finance geeks like me, we all have a responsibility to do this. So as we're meeting here today with a shared goal of improving safety, and I was happy to see that we're focusing on that today. I encourage all of you to share your ideas on what we can do together. The DOT, US DOT, Federal Highway, my DOT, on what we can do better and change the safety culture. That's what it's going to take, guys, changing that culture. So today, during this showcase, please think about how your agency, your personal expertise, and your personal responsibility. Say that again, your personal responsibility. That's talking to your friends. I mean, I'm gonna tell you a story. If I could go back to my 21-year-old self, knowing what I know now, I wouldn't have lost 4 friends in traffic fatalities. Speak out. Talk to your friends. Have them talk to their kids. Vulnerable road users. I mean, it's our responsibility, guys. So reach out to people. I wish I could go back, but I can't. So I'm going to end this with a quote from the Secretary of Transportation, Pete Buttigieg. and I have to read this so I don't misquote him. When it comes to roadway deaths, we have a crisis that's urgent, unacceptable, and preventable. We cannot and must not accept that these fatalities are somehow an inevitable part of life in America. Keep that in mind, and thank you for focusing on safety this year. And it's been a pleasure, and I appreciate the invitation to speak.
Thank you, Mr. Clark. Okay, our keynote. Our keynote address will be delivered by Dr. Allison Curry, Associate Professor of Pediatrics at the Children's Hospital of Philadelphia, affectionately known as CHOP. She is also the Senior Scientist and Director of Epidemiology and Biostatistics at the Center for Injury Research and Prevention. Dr. Curry is an injury epidemiologist by training, and her research focuses on the prevention of motor vehicle crashes and support of safety transport across the lifespan. Dr. Curry and her team have spent the last decade developing the New Jersey Safety and Health Outcomes, NJSHO, data warehouse, a statewide data source of traffic safety and health data that includes 24 million New Jersey residents, and have published nearly 50 research papers using this data. With the generous support of the New Jersey Division of Highway Traffic Safety, her team is now working to establish the NJSHO Center for Integrated Data, whose vision is to reimagine how to collect, integrate, and disseminate traffic safety data. Dr. Curry is also the principal investigator of a large research program to support driving safety for teens with attention deficit hyperactivity disorder, ADHD, and autism spectrum disorder, their families, and the groups that support them during the learning to drive process. Please give a warm welcome to our keynote speaker, Dr. Allison Curry from CHOP.
Figure out how to get this thing to work first. Does this work?
Yeah, right. You should have rehearsed this.
It's okay.
Yeah, you should. It helps if we turn it on, right?
Turn it on,
there.
yes.
Then if you want to
That
do
would
that
help.
with the red thing, that's hot.
I
too.
will do that.
Yeah, there you
Thank you. It's fun to be here and see all of these faces. I've been at CHOP now for 15 years over the river, but I am born and bred on Exit 14 in Bayonne. And like most New Jersey teens, I did my share of pre-licensed driving in Wildwood, where my parents still live. Yeah, I know. Did you hear the accent? No accent. Only when I get mad. I had my first driving lesson, no joke, on Tunnelly Avenue in Jersey City, where the instructor drove me straight to Tunnelly Avenue, so that was a harrowing experience. And then for my first year of driving, my commute to my high school in Staten Island was over the Bayonne Bridge. And for those of you who've been on the old Bayonne Bridge, you're literally going over like a blind hill at 50 miles per hour. So I do credit New Jersey for making me the driver that I am today. And I also know what it is to lose a loved one. My best friend when I was 12, Maria, died in a head-on collision on the way to my house for a sleepover. And so she's my personal inspiration, and I really do see it as a personal honor to be able to contribute to keeping those all road users in New Jersey safe. So my heart is in New Jersey, even though I'm not always here. So what I want to talk to you about today is really the power of data integration. And there are several recent safety strategies which have emphasized both the importance of data integration and using a data-driven approach. We hear that over and over to improve traffic safety. These include, we heard about at the summit, the Safe Systems approach, CDC, the National Roadway Safety Strategy, and even New Jersey Strategic Highway Safety Plan. I was very excited that data is a core emphasis focus area. So I have been my team and I have spent the last 13 years really with a labor of love thinking about data integration in the state of New Jersey. So I want to share with you kind of the vision that I had when I first started for the initial development of what we call the NJ Show data warehouse. All of the data sources that are currently in the warehouse. And then I'm going to talk through some innovative features that we've incorporated and how it's enabled us to do some critical research and how we could answer just a host of unaddressed research questions around the state. And then my vision, kind of what we're thinking about now, and then of course a plug for collaboration. So one of the things that I noticed when I first got into traffic safety back in 2009, I came here from the Department of Health in New York City, was just how many crash studies used crash data in isolation. And I started thinking, well, on the crash report, we really have like just the first few minutes before crash leading up to the crash, and stopping kind of when just after the crash when law enforcement gets on the scene. And from a scientist perspective, an epidemiologic perspective, when we think about the study period, we really just have a few minutes, right? So we're talking about a few minute study period. And I thought to myself, well, we have such rich crash data in New Jersey. And I did a lot of linkage projects when I was at the Department of Health. And so I thought, well, what if we can pull it back, right, and link these crash data to data that occurred information that occurred way before the crash? What was the licensing history of the driver? What kind of adverse events? Did they have crashes? Did they have citations? Who are they? Where do they live? What are their factors that might contribute, kind of these underlying contributing factors? What medical conditions that they have? And then way after the crash, what kind of injuries, disability, mortality? Where are they getting their short and long-term care? What's happening after they get a DUI? All of this. And if we can do this and link the data, we're really extending the period of study to a few minutes to potentially decades. And so we've had the great opportunity to collaborate with several governmental agencies around the state. So the Motor Vehicle Commission, the Department of Transportation, the Division of Highway Traffic Safety, the Department of Health, and the Department of the Office of Information Technology to develop what we call the NJ Show Data Warehouse. Currently, the warehouse covers 16 years, and we're integrating 2020 and 2021 right now. And it includes numerous administrative data sources from around the state. And I'll walk through these. They include the entire motor vehicle crash report data from the state, adjudicated traffic citations, which are already integrated into the driver licensing data, the entire New Jersey licensing database, EMS and trauma registry, hospital discharge, so every ED, outpatient, and inpatient hospital discharge in the state, regardless of whether it's a motor vehicle crash or not, so all hospital discharges. We also have 200,000 CHOP patients who live in New Jersey. And luckily, we have electronic health records back to 2004 from CHOP. We were one of the first adopters of electronic health records. And so we were able to integrate all the childhood medical records into the database. We have birth and death certificate, and then I'll talk about this a little bit longer, but we have rich community indicators down to the census level. So far, we have 125 million records on 24 million New Jersey residents. And in order to be in the New Jersey Show, you only have to appear in any one of these sources. So we really tried to, my interest is in traffic safety, but I really wanted to make this database so it would optimize its use way above even traffic safety or injury. So if you are, say, born in New Jersey, and you have a hospital discharge as an infant, you're in the NJ Show, right? If you're a bicyclist who have never, you're 16 years old, you haven't been licensed yet, and you show up at a hospital, you're in the NJ Show. So it has use for both traffic safety, injury prevention, and then even further into health services. And then it also follows individual over time. So the way we set up the warehouse is that on a day-to-day basis over these 16 years, for every resident in the NJ Show, we can tell what events they got in. Did they get into a crash? Did they show up at the hospital? Did they die? Were they licensed? Did they have a suspended license over the 16-year period? And then I don't talk about it much today, but we also linked these entire data to the Medicare and Medicaid data in New Jersey. So we're working with researchers in Brown University to look at driving outcomes among older drivers with Alzheimer's and related dementias and the causal effect of medications on older driver outcomes. Okay, so why isn't crash data good enough alone to assess the traffic safety landscape? Why is it so important that we need to think about integrating data? So if you take one of the central aims in our field is to reduce the number of injuries, right? We see that in the Strategic Highway Safety Report, reduce the number of injuries. Well, the crash report doesn't even do a good job of telling us the number of injuries. And so it can't drill down to things like who's getting injured, to what body part, what are the severity of these injuries. And one of the things we did was we looked at all injuries that were either on the crash report or in New Jersey hospital data. And what we found is that New Jersey crash data misses up to 1/3 of all crash injuries. And the picture is even more bleak when we look at vulnerable road users. So when we looked at bicyclists, we found that 60% of bicyclists that were injured can't be found anywhere in the crash report. So I think this really speaks to the need to integrate these data sources together. As was mentioned, we have conducted over 45 research studies, all in New Jersey, among New Jersey drivers using these data. And so this QR code, and I'm sure you'll have the slides afterwards. Is that true? Okay, but this link goes to our homepage on the CHOP website, and we'll link to all 50 research papers. If you can't access them and you'd like to, please contact me. I'm happy to send them along. But I do want to mention this one, which was we published in Injury Prevention. And this is basically on the methods of how we developed the NJ show. Really walks through how we conducted the linkages. Okay, so I wanted to give you a few of the innovative features of the warehouse and then how we employed these to do certain research, to address new research areas. And so first, as I mentioned at the beginning of the talk, the NJ show, the way we set up the data really gives us this longitudinal perspective, right, over a decade or more. And so we've used this, for example, to do retrospective cohort studies among drivers with medical conditions. And particularly, I'm interested in driving among autistic adolescents and adolescents with ADHD. We also have another paper coming out on depression. But we can connect, or we did connect, the electronic health records back when children were 2 and 3 and 4 years old, right, to their licensing and crash outcomes among the state. And so if you think about autistic teens, right, the ability that, 1 in 35 now teens in New Jersey are on the autism spectrum disorder, or have autism spectrum disorder. And the transition to adolescence is a really hard time for them. They lose services. A lot of them report being socially isolated and not participating in community events. So the ability to drive really does have great potential to increase independence and mobility for autistic teens and ultimately quality of life. However, before we started this work in 2013, we knew almost nothing about autistic teens and driving. And in fact, these are comments from the scientific community from when I wrote my first grant in 2013, filled with speculation about whether autistic teens can drive. Highly likely that some teens with autism will become upset with the new experience of learning to drive. We have no idea why they would need to drive. Highly unlikely to improve their health, and they're an injury risk to others. And so this really motivated me to get to delve into this issue and even figure out how many autistic teens are driving. And so what we were able to do is create a cohort of CHOP patients who were seen in adolescence, were New Jersey residents, right? So we had 67,000 New Jersey residents. You can use, or we use, the visit level codes and kind of known chronic conditions in the CHOP electronic health record. And then we confirmed that which children had autism and did not have autism. And then we were able to get licensing rates by connected to the licensing data. And what we found was that currently about 1/3 of teens in New Jersey get licensed. One of the things I don't show here that was the most fascinating actually was that among those teens who get a permit, autistic teens who get a permit, 90% of them go on to be licensed. right? So it looks to me like the drop-off in licensing is actually before autistic teens even get behind the wheel. And so this is where we've focused a lot of our effort now on figuring out that deciding to drive process and making sure that families and those that support these families feel supported in making the right decision for their family. What else we found that I show here, and these are adjusted rate ratios, and then the pink lines are for 12 months, the first 12 months of driving. And the blue line is the first 48 months of driving. This rate ratio of 1 would be that autistic teens and non-autistic teens have the same rate of crashes. So what you can see here is that when we looked at the rate of crashes is that autistic teens have similar to lower crash rates per driver than their non-autistic teens. Now, of course, we don't take into account that they might drive less, but what I do think this shows is that they're able to organically kind of modify their driving to ensure that they're able to be safe drivers. And so this is, we have a very big outreach at CHOP, and so we have all of web pages about learning to drive with autism and ADHD. And in 2022, we had 25,000 hits on our Learning to Drive with Autism page. And so I really do think this message needs to get out to parents and teens and stakeholders. Okay, second innovative feature I wanted to mention was the incorporation of individual and community level equity data. And we talk about equity a lot, both today and at the Safety Summit. Many of you may know that race and ethnicity is not collected in the New Jersey crasher licensing data, and this is true in other states as well. And it's so important that we're able to look at differences in non-fatal crash outcomes among drivers in different racial and ethnic groups. And when I went to the literature, I saw a few studies on fatal crashes that had used FARs, but very, very few studies that have looked at racial and ethnic differences among non-fatal crashes. And so even though this information is not in the crash and licensing data, it is in many of the data sets that are connected to the crash and licensing data, including hospital discharge, our electronic health record, and birth and death data. So we can use these data to get racial and ethnic information for the majority of licensed drivers. And so what I show here are licensed drivers just in 2017. This was what we included in this one paper. 6 million drivers. 77.3 were able to get a reported race ethnicity from one of these other data sources. But it's really important that we don't do analyses just on this group, right? Because those that are members of marginalized groups are more likely to not be in this 77.3%, given that it's, hospital data. If they're less likely to go to the hospital, they're not going to be here. So any kind of analyses that we do, this just complete case analyses, is going to be biased, right? So it's really important that we capture these other folks. And so what we've used is an algorithm that was developed by Rand Corporation called the Bayesian Improved Surname Geocoding Method. And basically we can use census data, the last name of a person, and their address in order to assign 6 probabilities that that person is in one of 6 mutually exclusive racial and ethnic categories, right? So each person gets assigned 6 different probabilities. They're not classified into one race, but we could use this information then in our models in order to get crash rate estimates by racial and ethnic group. So once we apply this algorithm, and again, here's the source down here if anybody wants to read the paper, we were able to get it for the 21.6% additional individuals. So we now have racial and ethnic information for almost every licensed driver in the state. The other thing we can do, and we did, is to geocode both residential address and crash location. Okay, so what does this get us? It gets us 2 ways to characterize communities of interest. We talk a lot about needing to delve down into the community. One way to delve down to the community is where do crashes occur, right? That's like an urban planning lens. Where do we need better guardrails? Where are the scary intersections? Where are the crashes more likely to occur? What curves, right? This, you think a lot about infrastructure progress that we need to make is kind of through this lens. And there are tools in New Jersey, such as Numetric and Safety Voyager, that that focus on where crashes occur. But we also need to focus on who crashes occur to, right? Where the crash-affected individuals live. If we have an educational program and limited resources, what community is going to benefit from that educational program the most? And it might be different depending on whether you're looking at car seats and seatbelts or alcohol impaired driving. The community that's going to need that support is not the same, right? So you need to be able to know where people live. And that's really the public health lens. I'm a public health practitioner or public health professional. That's really where our focus is. So here's a few examples, right? We found that in 2014 to 2017, there were a total of about 59,000 drivers in New Jersey who had a child less than 8 years old and were involved in a crash. And overall, 72% of those had child occupants restrained in a child restraint system. This clearly tells us we need to do better, right? We want to get that number up, but where do we start? Having understanding of where people live gives us a graph like this, right? So this is the proportion of those crash-involved drivers that had all their children restrained. And you can see that it's very different for the lowest income areas in New Jersey and the highest income areas. So this is CRS use among crash-involved drivers that live in the lowest income areas, and this is the highest income areas. So it starts to get at like thinking about where we need, to support communities. And then you can get something like this, right? Because we have the exact address, the census tract of every driver, we're able to this is just a draft, so don't try to find your census tract on here. But you can look census tract by census tract, and what you can see is actually a wide variation of crash-involved drivers that had their children restrained in child restraint seats. So it really can delve down into the community level and figuring out where we have to implement and evaluate our public health interventions. What else it gets you is an understanding of different county, different county level issues. So what we have here is just an example. I just took an example for Essex County. I should have done Hudson because that's my home county. But the rates of alcohol-involved driver crashes, right? So among 10,000 licensed drivers living in Essex County, what is the rate of alcohol driver crashes by sex, by age, by race, ethnicity? So you can really get individual level and community level rates at the same time. And notice that we do use rates a lot here, and one of the issues of using just counts, right, is that the biggest county is always going to look like it has the biggest problem. So we do use rates, and we're lucky in that we can, instead of using resident rates, we can use licensed driver rates, which also takes into account the fact that 20% of New Jerseyans don't have a driver's license. So, and this compares to, by the way, this is like New Jersey state right here. So you can compare each of the counties to the state level data. Here's another thing. I'm not going to go into the methods of how we do this, but you can actually use crash data to get a general, to get the prevalence of driving behaviors among the general population, right? So one way to do that is to stand, kind of do these observation studies where you're standing on the side of the road and you're like, seatbelt, seatbelt, not wearing a seatbelt, seatbelt. That's kind of an observational naturalistic study. There is a way to use these data to actually look at the prevalence of driving behaviors among the general population. I'm happy to talk about that with anybody as well, and I give the source down here. But what you see here is the percent of unbelted trips among New Jersey drivers. So what percent of all trips in New Jersey are when level, and figure out what this number is. And 2% doesn't sound that bad until you think of just how many people are on the road every day. And so the end behind this is a lot of unbelted trips, right? So if we're thinking about seatbelt interventions and what community might need more educational support, this will help with that. The last innovative feature I wanted to talk about was we have detailed vehicle and injury data. So we were able to link all of the vehicles in a crash in New Jersey to their VIN data that's housed in the National Highway Traffic Safety Administration's VPIC database. And so we have make, model, vehicle age, presence of safety features, presence of autonomous, driver assistance features. And we're able to figure out And we were able to figure out that the most vulnerable drivers, those that are young, those that are old, and those of the low socioeconomic status, the Alice's, are driving much less safe cars than other groups. And so what you can see here, this basically is the vehicles, all the vehicles that were in a crash that had a young driver and drivers of different ages. And what you can see is that young driver vehicles are much less likely to have side airbags, electronic stability control, and are much older than cars driven by other groups. We also mapped all of the ICD-9 and ICD-10 diagnostic codes to injury severity codes. So when we start thinking about what's the link between the characteristics of the crash and the vehicle, right, in that safe systems approach we're trying to engineer our way into safety as well, right? So when we think about like, what are the vehicle designs that need to improve? You can get a map like this, which is basically, this is all of the children that were hospitalized in New Jersey crashes in 2017, and what part of the body the injuries occurred to. So you can link this back to vehicle information, to crash information, try to understand what the link is between certain types of crashes and injuries to the vehicle occupants. Okay, so of course there is several decades more of research work that we have to do, that we want to do, that we would love to collaborate with you to do on this, on the NJ show data. But one of the things that we have been thinking about, my team and I, in the last few years is really that we've had universal interventions that are known to be effective in place, some for decades, right? GDL systems among young drivers, electronic device bans, seatbelt laws. These have all been in place in all 50 states. And yet, we still, especially in recent years, are seeing also a massive increase in the number of crashes and fatalities in crashes. And so the thing that I've been interested in, and from a public health perspective, is we really need to move the needle at the community level, right? That includes assessing and reassessing the traffic safety landscape in every community, which is constantly evolving given electric vehicles, micromobility users. So everything continues to evolve. So being able to assess the traffic landscape, locate specific communities in need of a certain intervention for a certain thing, right? So which communities need more education and potentially more CRS checkpoints, right? In what communities do we put those in? Allocating resources and countermeasures appropriately to those communities that are going to benefit from them the most. And then this is where data comes back in, right? To use data to evaluate the effectiveness within communities. And this is just an iterative cycle that should go on and on at the community level. What this requires is for those at the community level, the on-the-ground professionals, to have data at their fingertips to help drive this. And so integrated traffic safety data like what we have in the NJ show could be really helpful for these processes, but out of the reach of many traffic safety professionals, right? Like downloading data and figuring out CSV files and linking data, that is not something that's not the charge of on-the-ground traffic safety professionals. But we're lucky enough to have access to that data, and we've been really charged with and motivated to think about how we share that data with on-the-ground professionals, really to support your day-to-day work around the state. And so coming in 2024, we will have a website for our new center that in collaboration with the Division of Highway Traffic Safety, called the New Jersey Show Center for Integrated Data. And was mentioned, one of the things we're really trying to think about is reimagining how we're sharing data to support safe transport around New Jersey. And we would love to hear feedback as we kind of roll this out, as we keep to evolve it and make changes. But what the feature, the highlight of the center's website is going to be an interactive data dashboard. And so you see up here all of this is kind of like the starting pages that we have. There's an overview of traffic safety. There are profiles by community on road users and different driving behaviors. There's the ability to look at maps. We have pages on different vulnerable road users, so young drivers, older drivers, bicyclists, and pedestrians, kind of tried to mirror what the metrics were in the Strategic Highway Safety Plan. Using this tool, you can select any year, but so far between 2000 and 2019, 2020 and 21 to be integrated. You can select the road user, so whether there's a driver, pedestrian, or bicyclist, the county. So again, this is like, this dashboard is focused on the person, which is very complementary to Numetric, which is focused on where the crash happens. This is talking about where people live, what the community safety level. And then you can select crash category, crashes, injury crashes, and fatal crashes. And the important thing about this is all of the hospital data is integrated. So these injury and fatal crash numbers rely both on the crash report and that hospital data. So they give a much more accurate picture of injuries compared to crash data alone. And then you can look at kind of county level, at this demographic level, rates over time for each of this. This is just this one road users page. But we'd love feedback as we start to roll this out on what is needed around the state to help drive action. Another example of what we're going to show, I forgot to say there's a whole page based on equity. And one of the measures that we use is called the Community Resilience Estimates. And basically it's an indicator of community vulnerability. And what's really cool about this measure is that where most other community level measures measure things on the community, right, medium household income, this measure actually uses individual level data from the American Community Survey. And it's very interpretable as the proportion of residents within a community that are living with 3 or more of these defined risk factors. And examples of these risk factors are don't have access to internet, don't have health insurance coverage. And so we're able to look at each county. So this 22 basically is 22% of Atlantic County residents are living with 3 or more of these risk factors. And we can start to help communities look at the correlation between the equitable nature of that community and crash rates and their crash burden. And what you can see here from, this is Atlantic County, this blue one, but what you can see here is that these two are very much linked. And also understanding what's in these risk factors also help kind of inform what our interventions should have. So one of these risk factors that we don't have internet and non-English speaking, right? So if you're finding that communities that are in need of an educational or public health or traffic safety intervention are living in these communities, that's really important information to have. We shouldn't have a web campaign, right? Or we should make sure that we're translating it into other language or text into other languages. So, So we also have the social vulnerability index and some individual level equity measures in here. We're happy to consider others if anybody has other ideas. And then the last thing second to last thing I'll say is that the NJ show really is primed for research collaboration. We have several research collaborations going on now with friends at University of Virginia, with Brown, with Virginia Tech. And there's so many things to be able to look at that we haven't even scratched the surface of. So vulnerable road users, pedestrians, bicyclists, we haven't even touched these data because there's only so many hands. But the spatial distribution of crashes, like I said, we have both where people live and where they crash. So we had done a study that was just published, can't remember what journal, but it was looking at how far older drivers crash from their house. And so there are a lot of states that try to place restrictions on where older drivers can drive, right? They say, oh, you can't drive more than 20 miles from your house. Well, the fact is most older drivers are getting in crashes within 5 miles of their house. So are we putting these restrictions in place that are limiting independence, but not really doing anything for crash rates? So, but the spatial distribution of crashes, like into this urban planning lens that I was talking about, that's not my wheelhouse. So we haven't actually looked at all of these data in that way yet. The link between crash characteristics and injury. So as autonomous features become more ubiquitous in cars, thinking about whether those features can reduce injury risk among vehicle occupants. All of that's available and in these data. We heard about post-crash care. So now that we are in the process now of integrating this EMS data, triage, where are people going? Where are they being taken? You know, what kind of other injuries are being seen on the scene in EMS that might not be captured in these other data sources? And then back to the recent safety strategies, right? They also, in addition to calling for data integration, are calling for improved collaboration between partners, this kind of cross-sector collaboration. And this really has been a wonderful opportunity for us to kind of get out of our ivory tower and collaborate with those on the ground around the state. So, you know, the academic partner, CHOP, you know, we have research capability, we have analytic capability, we can set up these kinds of studies. But we really are so grateful to our governmental partners at the MVC, at the DHTS, at the Department of Health and the Department of Transportation. And we've found that there are individuals at these organizations that have gone over and above their job descriptions to help us get data. There's a person at the Office of Information Technology, her name is Nancy King, I think she might be retired, but she used to come in on the weekends when we first asked for data because she could only download the data by like last name, so she had 26 folders for 26 letters and 26 last names. She came in over the course of 3 weekends. I would have sent her wine, but I think it would have been a conflict of interest, but so I did it. But there are so many individuals that we have worked with have just gone over and above to support what we're doing. We really try to send back the information too, to make sure that the MVC and these governmental agencies are able to access the kind of work that we do. And also that they can show kind of the law enforcement right on the ground. Like they fill out these crash reports and they think like, what is this doing? Who is this helping? And we want to be part of that group that tells them that every time they fill out a crash report, it's helping us learn something to help keep people safe. And I learned that from my time at the Department of Health in New York City when people were filling out the birth certificate. We went to hospitals and they're like, I don't know why I'm doing this. The form's too long. So really going back and helping the law enforcement community understand how valuable they are in the chain of this research is super important. We work with some small businesses, which has been super fun. I know nothing about making websites. We've learned how to make Tableau data dashboards, how to incorporate equity. And then, of course, the on-the-ground organizations, I call out just one here, DVRPC, but this kind of wheel where we're able to make something and then they help us critically, you know, evaluate it and make it better over and over and over. And so we hope that the data dashboard will become iterative. I mean, we're going to start at county, but our goal is to be able to delve down more into the community, even further than that. But we're starting with county. So, so we'd love to hear your thoughts once again we roll it out. And I would be remiss if I didn't mention the amazing sources of funding over the last 13 years that have been able to make this work possible. And you'll see it's a really nice collection of kind of foundation funding from around New Jersey and federal funding from CDC, APHA, National Institutes of Health. And so we welcome, of course, any comments and questions. Feel free to email me. Here's my contact information, and we would love to hear from people.
Schedule. So at this time, if there's any questions for Dr. Kerr, this would be an outstanding time to do that. Just make your way down to where we have these mics and turn them on. In fact, we're in the process. And please tap into her. She's been doing an outstanding job. If you have questions at this time, please go to the mics. Don't be afraid. Don't be shy. And
we're very approachable in New Jersey.
Talk on the mic here. No. My question is, do attorneys, you know, when you deal with crashes, there's always lawsuits. Do attorneys have all this data in this New Jersey data warehouse?
They do not. And we have it's my back pocket slide. So it's the one other slide I brought. So we have very strict agreements with all of the data owners from around the state about what it means to be a data steward. And so we are prohibited from sharing this with third parties. We do not, I actually don't even have identifiable data myself. Only those research staff that need it for the linkages of these data have access to that. So we're guarded both by memorandums of agreement and data use agreements with the state, as well as our institutional review boards at CHOP, at Brown, and through the Department of Health that really all kind of spell out how we safeguard these data at the same time that we're able to use them to make a difference.
Okay.
So no, the answer is no.
I think building on that question, I would just want to ask about how you link the MVC with the medical records. It's probably Social Security number. Is that
I did not bring that slide, but I do have an entire slide on all the linkage elements in each of the data sources. We do not actually use Social Security number, I think. We use a combination. So different data sources will have different information available. So we have first name, last name, address, date of birth. To link the crash to the hospital, sometimes we use like location. We use a number of different variables, not just one in any source. When we first linked the MVC and crash data, we actually used a deterministic linkage. And so many of them actually linked on exact driver license number. And it was astounding. And what we realized is that the MVC and DOT both double enter that number, right? So it ends up being like a really good, accurate number on both ends. And so once we move to link, because basically we link all of these data at once. So now we use probabilistic linkages, but we've done hand reviews, I've done validation to ensure that we're doing it with high quality.
okay? Also, thank you so much.
Sure.
I had one question about the data collection as well. Are you able to get any information from private insurance companies of some sort? Because I know in some cases there might actually be crashes where it's not reported to the police, but instead it's reported directly to the insurance company because of no injuries of some sort.
No, we have not acquired that data or tried to acquire that data. You know, of course, there's always going to be crashes missing. I think New Jersey actually has kind of a low bar for police report, which is $500 in $500 in property damage. So compared to Pennsylvania, which like kind of requires towaway and injury, I think we're capturing kind of a higher proportion of crashes in New Jersey. And also the most important public health metrics, I think, are kind of injury based. And so these little fender benders that are occurring are, I don't want to say of less public health importance, but I think it would be very hard to kind of get that data.
That's fair.
Yeah.
Thank you.
I have a question. Oops. Oh, it's on? Oh, okay. So in one of your slides, it said that you had information about 24 million people, all of New Jersey. So based on New Jersey licensed holders, anyone that could have been in a automobile accident, whether they were the driver or the passenger, which could be many of us in this room, how safe is this database that you have with our all our personal information against cyber attacks?
That's a great question.
Yeah. That's what I'm asking.
So hospital data and hospital organizations are probably the most safe, data fortresses that there is. So because we keep PII on million visits per year of children. And so so our hospital is about as safe as it can be in terms of data, in terms of being able to safeguard the data. So they have multiple levels of safeguards of data that we have at CHOP, including, like I said before, the fact that there's only 2 individuals that even have access to that, to PII to begin with. Everything in the NJ show that anybody looks at, except for those 2 individuals, is completely de-identified. So you would never actually know who anybody is, and there's no reason for us to know who anybody is.
Okay, so before I sit down, so you did say all this information that you gather is housed at CHOP? with the database?
Yes.
Okay. And you're saying it's safe? I'm just making sure.
I'm saying
because
the CHOP,
it's so many
hospital-
things that have with cyber attacks with
Completely
DOT,
understand.
other agencies. It's just, you know, a lot of people information have been stolen. So it's just me being concerned about the
of
safety.
course.
That's all.
Of course, and
It's
it's
not
always a
anyone concerned about themselves. I'm concerned about myself.
Yeah,
My
no, I
identity
totally
was
understand
stolen
that.
before.
And you know, and to make progress in public health, there are like, you know, birth certificates and death certificates and lots of data that is very, very personal needs to be accessed by somebody in order to keep making public health progress. And so, but at the individual level, I completely understand what you're saying, right? And so the hospital data and academic institutions take this extremely seriously, of making sure that things are as safeguarded. In fact, we've had an audit by our IRB to ensure we're even following what we said we were going to follow in terms of safeguarding data. So, so it's about as safe as it's ever going to be, right? I mean, the MVC could get cyber attacked, so it's not like it doesn't live somewhere else. But we completely de-identify it the minute after it gets linked, and nobody, including me, has access to that. Except the individual that conducts our linkage. So, but I think it's a really important question, and I think it's really important to balance the nature of release. The Motor Vehicle Commission has, you know, trusted us to be a data stewards and agents of the MVC. So we constantly feed back and look through and have our lawyers look through the agreements and making sure that we're following them.
Okay, thank you.
You're welcome. I'm glad you asked that question.
Hi, Lisa. Thank you for a very good presentation. So I have one question. So your database include climatic conditions or roadway infrastructure conditions, because those two things are also major impacts for crashes, right? So your data include those, or
they don't, only because we haven't. See, so because we're externally funded, the way that I've been able to fund these data are through research questions, right? From the National Institutes of Health. So if someone had a climate related question, we absolutely could link all of that kind of data into here. So I'd be, you know, really interested if somebody was interested. So it's possible to link that in here because we have the, you know, the dates and but currently it isn't, but only because we haven't done research on that yet.
Oh, okay. Thank
you.
you.
So very possible.
Yeah, okay.
All right. Oh.
She's making her way to the front.
Very nice to see you again, Dr. Curry.
Thank you. You too.
It's been a while. So I had two questions, and you can choose to answer one now and answer one later, because I don't think we have time for two questions. The first one, when you mentioned the bicycle, pedestrian bicycle data, you mentioned that 60% of the data is not in the crash reports. Usually, the crash reports reflect the crashes with a motor vehicle. So if you have any micromobility devices that are contributing towards these crashes, it will not be captured in the crash report, because micromobility devices are, as you know, considered pedestrians with a personal mobility device, right, in the NJDOT report.
Mm-hmm.
Have you been able to drill down into the data to see which one of those 60% are those micromobility crashes?
We have not yet, because from my understanding, it relies on the ICD-9, ICD-10 codes, which I think now I think there's education going on in hospitals about the use of these ICD-9 and 10, or ICD-10 codes for micromobility. But back when we have our data, I don't think they're trustable. So the micromobility injuries are something that I think we really want to do in the future, but need the kind of quality of the data to catch up with it. So So I'd love to hear your thoughts kind of offline about what year you think that becomes, most accurate or more accurate to be able to study that. But yeah, we would, as long as the ICD-10 codes are in there, we would have the ability to capture all of the micromobility injuries.
Perfect, yes. And the second question that I had was specifically to do with the autistic licensing that you mentioned earlier. And as I understand, because I have maybe 3 or 4 cousins that are on the autistic spectrum, it is a really wide spectrum with the abilities varying drastically from one end to the other. When you did your licensing studies for the autistic spectrum disability kids, individuals, did you take into account the wide range of the spectrum and the requirements for licensing for those?
Yes, so we looked at, all of our autism and driving studies are limited to autistic individuals with no intellectual disability. So, but even on your point is well taken, even with those without intellectual disability, there's a wide range, right? And so what we're really focused on is driving's not going to be for everyone, right? No matter who you are, autism or not autism. 67% of parents and teens on the spectrum have told us they're interested in driving, and only 30% are getting licensed. So we're really focused on this disconnect, right? Licensing isn't for everybody. For some are going to have training in public transportation, but being able to support everybody in making their decisions on whether they want to be a driver, because what we hear from parents and teens are the teens want to drive, but are limited by parental anxiety, their anxiety, the fact that they have so many more lessons and that a lot of that isn't covered, so insurance concerns. And so that, so we're trying to take into account the entire spectrum, that some will be able to drive safely and some may look at other forms of transportation.
And just an FYI, we might be reaching out to you to be on our ASD-ISD task force.
Thank you. I'm looking forward to knowing what that algorithm is. I mean, that acronym. Oh, got it.
Okay, any other questions? Okay, great. Let's
Thank
give
you.
another round of applause.